my name is Leo Ludwig. I'm an orthopedic surgeon here at the Orthopedic Center of Illinois. I played a lot of sports in my life. I played college basketball, and through that experience I gained an interest in musculoskeletal problems, knees, hips, ankles, and I just carried that forward into a career in medicine, and it's been fabulous. My passion for excellence is to see a patient come in with a problem and then see that patient in follow-up doing much better, walking better, feeling better, less pain, and with a smile on their face. And when you see that builds a passion of excellence in you and wants you to keep doing what you're doing. Probably the most challenging case I ever took care of was a young man that I actually knew. I wasn't on call when he came in. He was in a motor vehicle accident here in Springfield and probably had about 15 fractures. And I knew his parents, and they called me. I went in the middle of the night and took care of this boy, and I probably operated on him 25 or 30 times. And now he has gone on to get a college education. He works as a social worker at a hospital down in Charleston, Illinois, and he's helping others despite the fact that he's ended up with an amputated leg and multiple injuries. He's become a very productive person in our society, and that was probably the most challenging case I've ever taken care of. I think they're all rewarding, to be honest with you. Every patient that we see, I think we look as an individual challenge to do the best we can for that patient, and so they're all challenging. And I think if we look at that and we treat each individual patient as a challenge, we're going to do a better job for each person. I've been practicing orthopedics in Springfield for 26 years, and medicine's changed a lot in those 26 years, but I think that our goal of taking care of patients and our passion for taking care of patients has actually gotten better over time. And one of the reasons is our technology's improved, and as the technology's improved, we see better results. And because of those better results, it's more fun to practice. We're here today to talk about anterior hip approach for total hip replacement. It's a relatively new procedure that we offer here at the Orthopedic Center of Illinois. We're the only facility in Springfield that offers that. This is a total hip component with a model of the femur. The total hip has a shaft component that goes into the intermedullary canal of the femur, like something inside of a pipe. The cup is a combination of metal and plastic, and obviously the ball that's on the end of the stem would articulate with the cup. And so when we're done doing a total hip replacement, the components appear as we see here in the photo. The other advantage is the dislocation rate, and the ability to get the legs of equal length is also improved through this anterior approach. It's something that has been developed in the last 6 to 8 years, and we're very proud to offer that at the Orthopedic Center of Illinois. Traditionally, most patients have had a hip replacement done through a posterior approach, which I'm showing here on the pelvic model. What we do in this approach is actually go through the front. And when we go through the front, we do not cut any muscle. We go between muscle planes. We preserve the posterior capsule, which is the strong ligament structure in back of the hip. And by doing that, we lower the dislocation rate. It's much easier to get the two legs of equal length by going through the front. And because we don't cut any muscle, the recovery time is much quicker. The strength returns to the hip quicker, the gait normalizes quicker, and overall we think it may provide the patient with an improved result. I would tell patients that the main reason to come here is that I think every physician has a primary goal of looking out for that patient's well-being. All the doctors here are well trained. They care about the patient, they care about the patient result, and I think it shows not only in our results but in the the fact that a lot of our patients are repeat patients that keep coming back. They send family members, and that I would say is probably the main reason why patients should be coming to this facility.